position to 90 degree and laterally rotate the shoulders slowly. If maka so you abduct to 90 degrees and then laterally rotate the shoulders slowly. Then for a fulcrum test, same position but place your hands underneath the glenohumeral joint and then apply mild anteriorly directed force to posterior humeral head. If the patient feels or looks apprehensive or alarmed and he tries to resist further movement, it indicates that there is a anterior instability. Then, if posterior pain increases upon mild anterior directed force, it indicates that there is a posterior internal impingement. So, by the way, you should ask the patient if maka-feel pain during the movement and or maka-feel ko siya apprehension para mahibawan nimo if positive kasi siya instantly.
Sige, so, lang guys, like, a reminder lang, so, may some tests for lethargic polity low galing, press ako galing, ikaw may naman for akong effectiveness ng pilo, so, hindi siya maka-full sa mga education. So, kaya lang, like, may other test na better if wala. Pero, of course, especially for extremity, better if na, like, comfort lang. Pero, usually for upper extremity, mga 5, DMJ, mga special tests, like, if possible lang, if, like, kung sa ni patient, yung wala so, kaya ko siya sa kanto lang, force. So, special test na guys, so, possible sa, ayaw sa siya, buka ka like, against like, kung ano man, anti-ear force na moderate. So, after you can check, so, mga kasi condition, check, ako check, ayaw lang, pwede sa akin sinuban lang. So, kaya, kung na lang kayo, like, one shot o dyan na yung one time, next time, dapat. First week buhat kayo, makita ninyo ang result of patient. So, what do you mean by apprehension? Fear, so, ang patient
Nagduwa-duwa sila.
sakitan niya yung so kanan na pwede siya mag-aggress siya, so kumana siya apprehension. Sige, next.
When it comes to those tests, like, do you basically do the apprehension test twice while naka-anak or ining ka fulcrum test kay imo lang bilit suot kay imo lang i-insert?
Kana, like, if na guys, like, first, di ba, kaya apprehension, so, same lang yan sa room, di ba, like, after A-rooms, B-rooms ka, so, same lang yan po, like, thought, ganyan na mo, lahos ka, very efficient ka, pero of course, hindi ka mo lahos sa fulcrum test, so, pwede rin mo stop ng ka-putol sa ear apprehension test. So, if feeling mo, need ka mag-fulcrum test para mas maka-diagnose ka, kung maka-rule in or maka-rule out, so, ara na ka mo lahos. Pero if once kayo makita na ganyan mo ang positive results sa apprehension test pa lang or like yung mga nag-get yung desired na result ni patient, so alam siya mag-lang. So hindi na siya starting apprehension test na wala siya full-group test. Full-group test is actually like a different question na siya, more siya like additional to the acute apprehension. So hindi siya necessarily if apprehension ka, acute apprehension, wala siya ka full-group, hindi siya necessary na.
Okay, so for anterior drawer test, so ang muhanghan, kaya na siya sa axilla sa patient. Yung patient kaya naka-abduct ang iyang shoulder o between 80 to 120 degrees, forward flex 20 degrees, and laterally rotated. So imong stabilization ani kay imong index o middle finger kay nasa spine sa scapula. Yan imong thumb kay na and ang imong thumb kay nasa coronary process, so counter pressure, and then imong ra yung forward ang imong humerus. So, ang positive ani kay either apprehension or click or both. If there is a positive sign, it indicates anterior instability, and if there's a click, kay naay tear sa glimmer. Yeah, dapat ini-test niyo kay first kay unaffected and then
Okay, so like, additional lang sa, so, may ubang test na mag-inject stabilization of that for messaging. Mostly of the test, okay, makuha na lang ang stabilization kay hindi siya ang first priority na to. Ang priority na to, kaya ang mabuhat ang procedure sa kuhan sa test. Pero may test like katong at your lower test o at your lower test, mag-hindi ka mag-stabilize para mag-get nimo ang desired result. So, kana lang, so take note lang, stabilization is not the priority for today's special test. Pero of course, you have also to make sure na sa kanino for ma-compromise ang pag-performing sa procedure. So, sige, next. So, verification.
Positive sign, ani guys, singali pa lang sa apprehension test kay sakit na. And then, once I do posterior glide sa head of the humerus, makafeel ang patient relief or hindi masakit ang ilang shoulder, means na ang patient na ay GH instability or subluxation or dislocation. Then, if ako siya i-release ang like di ba ako posterior glide, and then ako i-release guys, it's called surprise test, and then if sakit pag if sakit dyan siya, then you range guys, ang patient na ay anterior. The patient is asked to put and to place the hand of the affected arm, of the test arm to the opposite side of the shoulder. For example, yung affected arm ay ang right hand, so ang iyang hand sa right arm ay walang sa left. Then the patient is asked to bring the elbow towards her chest. Positive sign if the patient can do the procedure and the pain pain sa shoulder. Indication kay anterior dislocation, or if the pain is only in the AC joint, then a problem cannot be.
Next.
Doing this, stand position for horizontally, and doing this, and then downward.
for those that choose test
This is one way to do it. Another way is to
Find
making
the
the person do a well positioned
so if test mo ani kay ano para sa patient. Okay.
Yes, we use the rule, yes, makita ka.
well positioned.
So ang thumb mo kay naa sa ikot
Have a stitch, yeah, that's to check for it.
lateral, as external rotation increases. So, as a push move forward, external rotation ng facial. Then for posterior rotation, kay push move backward ang humeral head. It's okay if one then you push move backward ang humeral head. Mag-increase po ang internal rotation. So, ang positive side natin kay when excessive movement, so it indicates laxity of the capsule. Then greater anterior translation kay anterior instability and greater posterior translation kay posterior instability.
So actually guys, for rodent chip test natin yung mga variant mo, so ganun nakasupay, nakasusi, so sitting tayo siya, pero sige lang, importante ang nalahin na ito ang most likely kaya pag-position na ito.
Oh, pero sitting kay emergency push backward, push forward ng internal head.
This is good reason.
Ay, sabi ko, paana,
First too quick. Maybe we should do this because it hurts.
Check if you have TMS.
What if we done? That's the damper because of that.
The patient will be inspired and then there are
Other ones for the GH, instability.
with consolidation. And then PT will hold the forearm near the wrist. And then their thumb will be anterior and then fingers will be posterior.
It looks
So
like
for
this,
anterior position, the push will be
but I don't know.
anterior,
It's supposed to
while also laterally related.
that doesn't make sense.
So the normal for this is if
Yeah, yeah, yeah. It's
the interior band of the inferior glenohumeral joint is intact, then it should limit the movement and decrease the anterior translation while increasing the lateral rotation. And then for posterior translation, it was the rear thumb going downwards while medially rotating the arm. So the normal for this is that the lateral rotation
the last one, but the first one.
If there is excessive movement, then there is laxity in the capsule, and then greater anterior translation is anterior instability, then greater posterior translation is posterior instability.
So, the practice guys, so it's really important na ako tanawin ko or like kami ako tanawin nasa mo kasi like especially mga thumb or mga gagawin na gagawin for example thumb. So it's really important to know where you should put your thumb kasi niya ubang yan na distractible. So it's really important na aray yung pagkakita push yun. So kailangan ito tama niya yung mga thumb placement, yung finger placement, kailangan placement yung simple kasi niya aray na mo nag-push-push yung hindi ko na yung push ko. So kailangan the next cheers guys.
Yeah, mine's just like this, and then empty can.
Where patient will sit and then and then start off with your right hand.
It's definitely not pushing.
Medially rotation and adopted. I flex forward 90 degrees. So, then you need to stabilize the shoulders. And then on
hand, you need to put it on the base elbow, and then apply force going to your posterior shoulder, and then you need to move
It
across.
says posterior
You need to
translation on the
move
phone,
your hand across horizontally
but the
across the
fingers
chest.
are unclear and floating.
Yeah, if light production, convert, or clock, like this,
So it's like
click on that. So indications on the posterior. I return to the position or but posterior lateral.
So na ay term diri guys ay butang axial loading. So what is axial loading? Axial loading. So ang load padung sa axial skeleton. So axial skeleton. Diba? Kani, diba? So ang sa point na diri ang axial loading padung sa diri sa pala ang kuwan. Diri axial loading padung diri. So na sa grip test na axial loading. If not diri, axial loading. So, sige.
study na.
Pero di sa mga have to test or test number. We have to test the order. So if naka-mention lang sa procedure na need
Medyo na
I think for research testing or if necessary always like follow na the procedure kaya nila yung siya procedure unlike sa MSCRO kung grading yun ka, hindi ka mag-series 5-4, 2-1 na sa special test kay magay na kayo sa special test kay laki kung sila auto. So, sige, proceed to next.
Posterior apprehension. That was about stress test. So, already can gibuhat meal anterior, pero kanya ko it's just direction of okay going down. So yun. So there's two ways you can do this: supine or sitting. But usually it's one case na supine is stable, and then you want your patient to elevate his shoulders to 90, and then flex his arm also to 90 degrees. So what you want to do is put your hand or your hand to the elbow and one keep the wrist keeper out stable to one A. What I will see, you do not hold the wrist the way he faces in the ball he stabilize the scapula. Stabilize na if compensate the scapula. Hindi siya compensate. Only the down na siya stabilize. So, ang kanina, anterior man ako, almost siya. So basically, what the force with his elbow moving downwards, initial loading, and then what you want to do is adopt while internally rotating. Then, while doing this test, you need to do it very slowly kaya apprehension test siya. So, sakit siya. So, if I feel like something you might patient or discomfort siya now, stop with the immediately. So, next, then sa sitting kay same as siya, palpate ang iyang head of the humerus, and same thing. Then if nakikita siya, positive na siya o instability siya, posterior instability and then dislocation of your shoulders, or your humerus.
Like sa positioning, especially previous and post-convenient and additional sa diya is when you mag-input ka ng proper elevation din. So, especially if apprehension test siya, so make sure that you may know. So, kanina special test or kanina assessment mga teams ka din. So, ilan ang expect so, para rin yung proper elevation. So, it's really important to inform the patient kasi kanina test kayo, bukat into this. That's what we need to do. Mostly sa mga katuloy guys, remember sa next one, ang hapon na mga kay di ba, buhat nila gas speed, doha iyang quantity, doha ang pamot, yan ang si patient, higalo nila si diba, ang buhat nila gas speed, kaya na siyang, di ba, ang uban na naon din ang likawat niya, ang usa kay butang sa bus, so, Gerardo, pero kani si patient, pamusok ko siya, kaya kumara, ano yung mga para mo paano lang ako forward ko. Nag-situation mo siya pero lagi more day lang din din ba yun ang may ipahulog ng
Where's your other hand in this case, sir?
Sa table, sir.
ang isa ka hand kinandi sa ulos. Kaya para if ever nga mo
Sa scapula part, sir?
Sa shoulder?
Dili mo pili na actually dito na siya na basta ang importante na guys,
Yeah, because he said under.
ang thought ko na naman, mag-stabilize mo na may case din, like example, nag-procedure test mo, so dana, ang tendency, ang liberal na yung patient, ako sa hospital, bakit pabalik ka kayo yung gamit, gets mo, so para, hindi sa moral problems, kinulayan doon lang, so kana na, para makikil yung para gawas na, so kana balik na tayo, kana lang, okay, next, procedure test.
So, sa posterior lower test kay nasa constipation niya, feeling niya nasa shoulder level. What na yung mga
Wait, is it forward flexion?
reflex na yung elbow sa patient, 120 degrees. Imuang kamot kay
Ito yung
naka
thing for your forward flexion.
nasa proximal forearm. Then, 120 degrees niya, abdomen.
That's your forward flexion.
Tapos, forward flex, 20 to 30 degrees. So, yeah. Ang iwang isa ka sa tumulong kay nasa scapula, ang mga middle finger, yung finger, isa slide, scapula. Yung imutang, yung nasa barapod process. General kay imo i-medial irritate ang iyang arms, then forward flex 60 degrees. So, when medial irritate the arms, forward flex. While ang imuhang thumb kay ato sa humeral head that was pushed down, so that's clear the trachea.
Because we're missing the other part. What is the one that's a shoulder because it's the
Medial irritate niya, flex, forward, ang iyang positive side kay patient attention. Ang indication kay posterior instability and demonstrates posterior sensation more than 50% of the humeral ischemic diameter. Next.
Okay, so for the push-pull test, you want your patient supine, and then your first hand would be would be placed on the patient's wrist, and then you're gonna have your patient abduct to 90 degrees and forward flex 30 degrees. And then for your opposite hand, it's gonna be placed around the femoral head, but just below it. And then for this test, since it's called a push-pull test, one arm is going to be pulling, one arm is going to be pushing. So the hand that's going to be pulling is the one that's placed on the wrist, and then the one that's going to be pushing is the one that's placed below the femoral head. So, you're going to do this slowly. It's a apprehension test. So, check your patient for signs of any pain or apprehension. So you're gonna pull and push at the same time. So positive sign would be
What is there right
uh, more than 50% posterior translation and patient pain or apprehension. And then the normal value for posterior translation for the patient would be 50, and then indication would be posterior instability.
That's Flores. Mayroon yung sulfur sign, so figure natin skip it, like, so paproduce yung sulfur sign. Next lang na sa tigil.
So I was your patient.
now? No, I'm not sure. We're good now.
For the begins test, kay nayon do ka position either standing or sitting. So for sitting, kanin. So ang imong baton, imong ipa-abduct ang arm sa patient 90 degrees, kaya extended ang elbow, and then you're supporting the hip against your own body. Here, just lateral to the acromion process. Ang imong baton na imong i-push down and forward. Down and forward. More na. And positive sign of this would be if there's a sulcus above sa coracoid, and then also if naive patient apprehension. And then indications I think inferior capsular laxity, or if positive on both vegan and sulcus test kay multidirectional instability.
So, kailangan guys, during cramps ganun, so kailangan na siya yung mga alternatives na siya yung sitting standing. So, pwede rin sa yung pangatong. Sige ko na lang, ang sulfur side guys, kaya again, siguro na i-pull down ang articulation focus niya. Makakita ka muna na yung gap sa coracoid process. Basta nila sa may clavicle dahil o murag sa grade process. Basta makakita mo murag gap nila sa mga mga sa basically same mo sa vegan, pero ang vegan guys natin nila ang iyang murag suppression sa so this time is for now here is okay, next.
So, we're gonna move on to the lab. That's for the behavioral regions are there. So first test is the active compression test of O'Brien. So you're gonna have to let your patient stand. Then first, actually this test is to detect the type 2 of slap lesion. Type 2 slap lesion is the most common, wherein your superior labrum is kanang na-tear siya pero small lang, like there are small tears sa imong superior labrum. So going back, may pa-stand si patient din, imo siya ipas-flex sa iyang arms to 90 degrees. Then elbow should be fully extended and niha. So the next kay imo siya ipa-adduct 10 to 15 degrees lang. One imong starting position. Then ang imong first test na ibuhaton kay imong medially rotate nimo si patient. Medially rotate. Ang PT kay nasa likod guys. Yeah. Pero ipa-coordinate nimo siya si patient. Then naka sa likod, then mag-resist ka, maghatag ka of force downwards, then this is your first test. Ang next test, imo siya laterally rotate or supinate, then makatag na sa resistance downwards. Then, positive side ani kay if sakit gani siya, if medially rotate, like maingon si patient nga, sa first test nimo kay sakit siya if medially rotate, pero if mo laterally rotate siya,
if rotate siya kay wala na sakit, mo na yung positive sign for the na naa siya yung slap lesion. Nigeria, again bulol ko. If mo medially rotate siya or mo pronate, then one at patient, hala sakit. Pero if imo siya ipalaterally rotate, then ana siya nawala ng sakit, mo na yung positive sign. Nigeria, alright.
Go, let's go.
So let's say for example, you're wondering if your patient has a slap lesion now, specifically here, maybe sa ilahang anterior superior part. Mo specify siguro na ang patient whenever they do certain activities, kaya na sila ma-feel ma-pop or ma-click here. O nga, maybe when they do again certain activities, masakit yun yung ilahang shoulder here. So what you can do is you can do the anterior slide test. So from the word itself, you're going to pretty much i-anterior slide mo ang humeral head. So what you can do is that you're going to ask your patient to put their hands here sa ilang waist. Kailangan ng thumb, kaya siya sa posterior, so nakaanak. So, you have to stabilize the shoulder over here, silang coracoid process, coracoid rather. And then, here silang elbow, you want to do an anterior superior nga force. So, you're going to ask the patient to nga kanang resist my force, no? Kanang i-maintain yung kanina position. Sige, start 1, 2, 3, go. Relax na. So, if they cannot maintain the position, pasabot there's a possibility nga naa sila slap lesion here sa ilahang shoulder. That's about it.
Okay, so what do you do by slap lesion, guys? So, what's up na siya?
Anything that depends the
Diba?
person.
Ako sa fossa, diba kayo, maarap na touch ang buwan, humeral head. So, ang nakapala ng humeral head, nakapagita na ng mga fossa kaya ang leg room. Sa leg room, natin na nag-attach ang biceps. So, insertion siya sa biceps. So, if naka-slap there, so, masabot ko, usually, nag-use ang biceps na. So, magka-tear ang inyong slap or sa tissue. So, usually, kaya mga activities na may mag-flex o mga biceps. So, take mo ng one of mga conditions po kayo. Possible yung cramps kayo, yung butang indication ay kayo mga manifestation lang sa let's say it's slap tear. Isip ka na flex yung elbow na lahat. So, take note ako sa mga conditions kung medication nila. Okay, next. Biceps load. Test 2. Medyo lagi. Sampuran. Biceps load test.
After Machinari.
Okay, iba na lang sa biceps load test.
Ikaw naman eh.
So the biceps tension test is still for testing if a patient has a slap lesion. So if you do is have the patient stand, you go behind the patient, stabilize your salang shoulder, you have them abduct their arm to 90, laterally rotate, their elbows extended and supinated. And then you apply an eccentric downward force into abduction. Yeah.
Ako kay operation check ko dyan sa safety or spine niya
Kim the second minute.
ang patient position kay abduct yung shoulder mga already then yung elbow flex mga lateral rotated
4 hours rest. Yeah, I mean, then, yeah, ato equal ang apprehension test kaya ato equal lateral rotation. Yan, mahal if makapir ang apprehension kay up then ato ka lang ipa-flex na itong situation.
Another way you can handle this that cases they have difficulty
Mahal
standing.
siya.
Yeah.
Bukan ang resistance dari saya bukan kebangga. Bukan ang resistance dari ay hindi. Normal siya. Ang positive side na ito, sakit ang shoulder. Or okay. So basically guys, kami
Difficulty standing if they've been in bed.
Okay, again, evaluation, diba, that guy assess or so kato, after ka magsuhan man, running a position as the patient as a photo mag-ER, then after na adding ka so diba, okay, next, front test, sit-down, sit-down. Okay, next, first shoulder abduction.
For the forced shoulder abduction and flexion test, you have your patient sitting down. This test is entirely passive, so that means you're the one who's going to do all the motion. So you have to warn your patient that this is going to hurt because you're stiffening, right? So throughout this entire movement, it's going to hurt. So you have your patient's arm, you stabilize the elbow here, para mo extend, right? So what you do is, take a position of proper breathing. You raise it up, fully extended, make sure you firmly rotate. In this position, sakit na this already hurts for the patient. Now, the point of this is, when I bend the arm, I'm going to bend your elbow. Once you bend the elbow, if there is decreased pain, then that's a positive sign for your subluxation. If the pain is the same, then you need to do another special test because it should be less for subluxation or not.
Next, skill test. Skill test one.
Oh no, prevent compensation or something.
But we push here, right? Push on the test.
Yeah. Yes, you know, stabilization. Just prevent them from like
Then ang patient so patient is dapat seated and dapat back supported. So ang affected side is dapat ang arm naka-up 90 degrees, then ang elbow is flexed 90 degrees also. So ang usa ka hand is nag-support sa elbow at sa shoulder. So ang mag-apply ka axial compression and at the same hand, imo sa siya elevate upward. Then ang the other hand, you mag-apply of downward and backward na kanang so ang indication na ni kay kanang posterior inferior lateral
Next, baby shear test.
So you're going to lift your arm back 7 degrees and go back. So you're going to elevate it all the way. So what you're going to do is apply an anterior leader and at the same time you're going to bring the arm down.
didn't know girl was like resisting. I didn't know what you were doing.
The patient is in seated position with the arm abducted 90 to 100 degrees. Then una, stabilize the shoulder, then bukod sa wrist, then maximally spinning ang forearm, then maximally pronate the forearm. So positive sign for this kay kung maka-feel siya of pain only in the pronated position or mas severe ang pronated position kaysa sa supination. Then this indicates flat tear or a tear in the superior ligament.
Or is this all? It's all the therapists.
You're the one who like moves her arm around here. Does it hurt? If you feel like click
No, I'm
with it, they say within 90 to
The patient can argue inside the patient. I have PT on assistant the patient, so I'm gonna tell the patient to like position of the patient is flex 90 degrees and 10 to 15 degrees abducted. Abducted fibers on the patient. I'm gonna ask the patient to get maximally realistic. So dapat ang tao so for the first test, I'm gonna stabilize the patient with my arm up. So sugi na akong pagsaka sa ay pag-down sa imong arm. Ang second is same rig ako na position. So, pero ang akong hand, akong thumb is nasa posterior bilateral sa posterior side sa iyang humerus. So anak yung second test. So same rig ako procedure para stabilize ako to avoid sa position of the humerus. So indication ani is posterior labral test and posterior instability. And may lang yung positive is positive siya is reduced pain with or without change in strength in the second test. Next, impingement of the
For the Watkins Kennedy enrichment test, kaya yung patient is standing at top. You're gonna forward flex the arm of the patient and then flex ang elbow. And then you force mo na radially rotate ang arm. There are two positions for this. Pwede siya ani. Pwede sa kamuhos, vertical shoulder, and then ang yan arm pa. Pwede mo yung pang radially rotate. Okay, makafeel pain ang patient, that is an indication for system spinatus para or tendonitis or secondary.
I thought it was.
it's basically
So for coracoid engagement test, same ra sa Hawkins Kennedy test. So horizontally adopt anak niya. We hold positive daily guys. So we count as a PT, ikaw na lang push down. So ang isa ni makahan kay mo hold sa elbow at ang isa kay sa wrist. So immediately rotate, i-push down and
I get it, pero
ang positive sign na kayo makafeel na ang patient to pain. Yeah, ang indication kay supraspinatus adenosis or secondary impingement.
usually sa mga impingement test next. For yung test, ayun na may
patient, touch their, using their very affected shoulder, touch their secondary shoulder, so and then you can either support the patient on the elbow going up, or they can do it themselves. So you have the patient here, your elbow up, and then slowly basically a positive angle like sa pain created when the affected basically the one is supraspinatus tendonitis or ligament sa arm.
My here actually said someone the spine of my scapula, but it's chronically painful. That's on the right shoulder.
So for the ear that's okay. First you have to stabilize the clavicle and the
Yeah, but there's also like a specific muscle that
the distal forearm salvation, and then i-raise siya nimo siya sa iyang scapular plate, medially rotated ang arm. So if mo show ang pain ang patient, that's positive, that's a positive sign. Pero if laterally mo, you should take lateral and then there's pain sa kaya dapat i-check ang acromioclavicular na joint. So for the modified, it's similar to the mere impingement, but mo say sitting ka pa ng patient and then mo abduct siya, and then as fast as possible i-flex ang elbow, and then the arm is pronated, then the thumb is facing down. And then for the second part, you laterally rotate the arm sa patient. If mawala ang pain sa second part, which is the lateral rotation, that's positive, a positive sign if mawala. And kung dili siya mawala or dili siya maka-abduct ang patient, dili maka-abduct, then it's a negative sign. So this is a follow-up na test for ear test, and this is when this test is used for us to differentiate the outlet impingement and non-outlet or subclavicular and intra-articular. And then this test will be used if like ang ear test nasa find siya na positive exam. So patient position can sit. And then arms abducted 90 degrees, and then laterally rotated 80 like this. So hold siya nga position, and then the other arm nag-stabilize here. Ang other nga hand can mag-give isometric resistance sa back or here sa front sa wrist. So mag-stabilize here, and then ang kanya siya, if kailangan ka mo test for the internal rotation, then ipa-hold minimum and then add resistance. Okay. And then if external rotation, kanya sa kasabak na. Yeah. And then ang positive signs and indication if na-siya weakness sa lateral rotation, then that could be external ear impingement. And if na-siya weakness, ay good yung sa lateral rotation, and sa medial rotation kay internal impingement.
Yeah, but like first it's interlateral.
So for supine impingement, you want your patient to be lying down supine, and then you're standing beside the left shoulder. So to do this test, you want to hold the wrist and the distal humerus. You elevate it towards end range, which is about 170 to 180 degrees. Laterally rotate it, and then abduct it towards the ear. From here, you want to medially rotate the arm. So a positive sign would be pain upon medial rotation. And this could indicate that there is impingement or non-specific rotator cuff pathology.
for the active, the patient stands and it's asked to reach over the opposite shoulder. So, ano? Ano kasi yan? Then for the passive, the patient is sitting. And the PT stands behind the patient. Hindi mo siyang i-flex ang affected limb 90 degrees. Then imong i-push horizontal adduction as far as possible. Then if maka-feel ang patient ng pain sa acromioclavicular na pathology sa isip. If maka-pain localized pain sa sternoclavicular na pathology sa sternum.
Guys, additional sa DI, especially kaya mga dalilan kayo mga other names yan. So, Zerlia, make sure na familiar mo sa other names yan. Kaya kapag sa board exam, usually ang combo pag-name ang gamitan sa exam na so, yan na lang. So, Zerlia, familiar mo na the next AC shear test.
Easy shear test dali na siya. So, ang iyong ibuhaton kay basically ikabot yung kamot. Then, ang isa kamot sa vertical, ang isa ay labit sa deltoid niya. Iyan na mag-compressor mo. Pareha na yan, pain siya sa yung easy, so may problem ang yung
And if they feel any pain or there's reproduction of symptoms, that is on positive side.
Maximus, next.
Centinels.
No, the test
I heard Centino, bro.
Ground test.
So for staff test, indicated niya for the government pathology. And then, overall, ang patient position ay seated. Ang difference ng ano ay may different arm position. Same kamo kay normally ang test for the government pathology. And then, after na ang PT, ang PT kay sa behind ka sa patient towards the affected shoulder. So if right ang affected, here ka sa right side behind. And then ang first one kay ang arm towards the side rack. So if ano yung arm is makapil ka, stretch ay niya. Ina ko yung makapil ka pain. Or yung makapil. And then to stabilize, yung hand ay diri sa yung elbow. And then yung isa ka hand ay diri sa wrist niya. So yung siyang iba, externally rotate. So, ang kani siya, ang arm towards the side, ang ligament na itas ani kay mukhang superior DH ligament and capsule. Now, if you will abduct ang yahang arm ay ang shoulder towards 45 to 60 degrees kay imong itas ani same rectangle na motion may stabilize kay imong externally rotate. Kani siya kay ang middle and inferior DH ligament, also the thoracohumeral ligament and the anterior capsule. Now, if you will move siya into rigid and 90 degrees of abduction, same motion na gihapon, stabilize and externally rotate. Kani siya kay ang imong itas here is the inferior DH and the anterior capsule.
inferior GH. Yeah. And then here it's superior.
Towards their belly. And while they're doing this, they try to raise their elbow forward or out. So if they can maintain this position, if they can, then they have or if they have a gift, if ever they come to like that, or their shoulders come
I remember extending them. I
You did this.
Yeah, we did this. It's here.
Basically, you have to feel not just the bones, but you feel if the patient's able to do.
So say you want to test for the subscap here, and then you extend the elbow, flex the elbow, and have the fingers extended towards your upper shoulder. And then the elbow should be in front of your body. So, therapist position, kaya you hold the elbow and you distal the wrist, and then after that, kaya you apply a perpendicular lateral rotation, which is basically away from the shoulder, and the patient has to resist. So, please not to resist. So if the patient is able to resist, then it's normal. But if the patient per se does that, kaya it means it's indicative of some damage.
We did this.
So for the belly ng sign, indication for this is uninjured
Within subscap is the most special test. At
patient
least here.
position is either standing or seated. It depends sa patient situation. So waiting position is naaka sa kabangan sa patient na and then you're gonna possibly hold the extremities. So ang kaning button mo ani is nakasupport ka sa elbow sa patient, imo siya ipa-flex mga 90 degrees, then imo ang ipa-medially rotate, and then imo ang ipa-elbow flexion 90 degrees. Then ang kaning kamot sa patient, imo siyang ipa-butang sa iyahang belly, na ipa-maintain that position with wrist straight. Nga, dapat naka-maintain sa nang position even if imubuhian ang kamot sa patient. So if di na niya ma-maintain, nga nakabuhay na imong kamot, if di na yung kamot, that's a positive sign.
Not underestimate. Was it overestimate? No, overcompensation. I don't know. You said something like that. Me? No, not
So
you.
next is for the main close test. So it's called that test. The patient position is in sitting, and then you're asking them to hold up their hand as if you're close sila. So that's around 30 degrees for flexion and then 30 degrees abduction, and then 90 degrees elbow flexion. So kind of like that, and then the shoulder should be slightly externally rotated. And then when they're in this position, when they're in this position now, kayo, the PT applies isometric force downwards, like that. And then if pinigana ninyo, maka-feel siyang pain, kaya kang such as
Was I supposed to resist this?
it's a positive indication for injury to the suppression of the muscle. So, pwede siya pain or pwede siya weakness. So, that's
We did this yesterday. Coach kept saying I kept trying to compensate by flexing my
So for the deltoid extension left side or the swallow face side, patient position is sitting or standing, pero ang natong buwan ko sa standing na natin. So una buwan ko namin kay itas na to na anterior side. So first i-extend arm para matest posterior deltoids. Tapos i-last tayo ng patient na hold in a position for 5 to 10 seconds. So next tayo anterior side. Ang positive sign tayo natin ay i-check na yung difference sa affected sa unaffected. And another way to do this is i-test nato both extremity at the same time. Tapos purpose natin kayo para masayo nito sa test, magkaroon nito ang difference sa tapos positive sign tayo if they do it's
that's their compensation.
Injury input sa posterior deltoids which is integrated with the axillary.
Do you want to see my beautiful penis?
Next, jump arm.
So for jump arm, we're going to have the middle position. So the PP, okay, that's just the middle position. And then the PP will abduct the shoulders of the patient. And then you're going to ask a patient to lower their arms to the side. Because they're the ones who will lower your arms to the side. And if the patient is unable to lower his arms or feels some pain, it is an indication of a tear sa epidermis complex.
The ventilator being I thought na I read sa una but turns out to be actually make them go into addiction. Yeah, just like yeah, feels like either or there's a complete tear of something.
So for dropping sign, ang position ninyo sa patient kay sitting, standing or sitting, yan. And he was aside sa patient's shoulder. So ang shoulder kay naka-abduct to 90 and then Okay, so stand at the left side and possibly place the patient's elbow in 90-degree flexion with the arm in lateral rotation 45. And then the PTS has to isometrically laterally rotate the patient against resistance. So mag-resist ka dili sa kaya mo padong siya backwards so yeah. So a positive sign is the patient is not able to maintain laterally rotated position niya mo drop ang iyang arms. So resistance and indication ani kay infraspinatus.
Okay, next.
And we're in the
If they feel pain between 90 and 100.
Other sign kay ang patient sitting or standing position with forearm related.
I'm not sure, bro. It depends on your
So, ang kuhan ka namin kay i-resist mo ang elbow flexion.
Exactly. It's like, why would I go back to school if I was back to cycling?
This is elbow flexion. Ang normal namin kay supination occurs as bicep attempts to have the brachialis muscles flex the elbow. Supination movement is called the Hoover sign. So positive sign kay absence of forearm supination and indication of ruptured distal bicep.
Yeah, I'm gonna put myself.
My question is, they're just gonna isolate the head.
Okay, so for lower side leg, this is to indicate whether there is a tear in the infraspinatus and paraspinal. So first, you're going to look at a patient in a standing position. It will elevate the orbital abduction and then flex into 90 degrees elbow flexion. Unya, ito ay ask ang patient to externally rotate and walk like a resistance. So it goes into eye balance.
You ask them to do this. If they can
So,
only do
positive
this,
side ang kay dili ka externally rotate ang patient.
meaning it's a
Then, ang
positive sign
modified
because
or
it
lower
means
side kay
the
ang
delta
hands sa
is
patient may
working
nasa
harder
side,
because the
kung siya
supraspinal
i-add
is
na
strong.
iyang hands equal sa iyang mouth. Then, imo i-observe if kanang ibutan kay niya iyang computer sa mouth kay naka-abduct pa una iyang arm.
Because you can do it like just this, but if you can only do this,
For the intraspinatus test, the patient will be standing with their elbow flexed 90 degrees and their fingers majority rotated 45 degrees. So what the PT does is apply medial force and then the patient will resist. So you can also, you have to make sure that the scapula is retracted and then you stabilize using your hand to stabilize the clavicle and then the scapula will be forearm and then apply. So positive sign is the patient has pain when trying to resist the lateral rotation and then indication is in the spinatus straight.
For the lateral rotation lag test, you need to position your patient into a standing or sitting or alternating or something like that. Start up with your patient, abduct 90 degrees, yeah. Lateral rotation, yeah. This one kay dapat mo siya i-lateral rotate sa end range. Yeah, if I ask the patient, if you hold the position, yeah, if maka-hold the position, kay negative test, yeah. Pero if bring some ganit sa anteriorly, kay it means na positive test. So, the eye witness in mo, yung natin yung paraspinal. That's the external lateral rotation, external rotation lab test. Kay abduct 20 degrees, yeah, lateral rotate sa end range, yeah. Yeah, if mo medial rotation din siya, kay it means positive test. So, it means
If the test has something to do with maintaining or holding a position and
yeah,
then
if
because
space
it's
becomes
injury,
more
it's
than 40
injury.
degrees, kay
If And like, if it's an active range of motion, or kasi something else, it's just a weakness or a strain. There's a difference here. Like when you're saying a rupture or a tear, so you really can't do a certain.
Yeah, ipa-hold imong patient. So, if maka-hold siya kay negative side niya, so niya. If mo-drop siya, kay na-turn supra, pinatus, extra.
It's just through ChatGPT, but it makes sense to me. It's what's called this?
Capillaries, patients has at the back or at the mid-lumbar spine, and then more patient
It's just ChatGPT.
like this because always
It's the plan of something that mentioned from the activities that your patient will is having a hard take off so internal
and then if makabantay mo siya kung yung kapila ay really siya ka na
No, I don't want to look for it. I want to do everything.
Normally, movement sa kapila na capillary stability and then passive lateral rotation. If a passive lateral rotation will increase by subscapillary stability. There's also a modified test. Biliar ang resistance and basically the motivation to immediately rotate as far as you go
every time
move away biliar ang mga resistance na you try and penetration to hold or as long as it goes kind of hold siya negative siya positive sa iyang kuwan kaya modified na look of test or dili niya kaya bili ng spring siya ang spring siya niyaman kay positive na siya partial taking ng subcapillary
I got this part about when you do this one as a player. I kept this part. But yeah, you're just like this one's doing you just want the version doing this like it's this part now. I guess do it like if they end up with it's mostly like I kind of get why it wants to do that, but because I think it shows a procedure.
Yes, para di may palpate ang iyang bicep.
Yeah, that's what I was thinking. But so are you going to do this in the first part? This is like its own kind of stuff.
You can do this first.
Yeah, I was thinking that I'm gonna do this first. Yeah, because there is a booty on the shoulder now on the cheek. I get the why you guys do everything. It's just like when you see the lateral, is it saying I should do this and then, or is it saying I should do this automatically? And then let's say for example, okay, there still is like a winning. Or we're still reading, so I'm just going to do sort of this. So I'm going to do that
paper basically the trusted so that that's already supposedly because this is already somewhere like there. Yeah, but then the people here, they're just looking for like the tendon as close
to the belly.
Okay, so for mixed pectoralis major contraction test, you want your patient to write. And then have your patient clasp his hands behind his head.
This is control. Is it?
So what you're gonna want to do is push the hand or the elbows of your patient downward toward the table. So you're gonna push it down towards the table, and then if your patient is able, the elbows of your patient is able to reach the table, that means he or she doesn't have a contraction in the flexed major muscle. The indication would be the elbows are not able to reach the table, and then the positive side is the elbows are able to reach the table, and then that's the indication of tight pectoralis major muscle.
Normals if they're scapulary tracts.
For next minor tightness, you want the patient in a supine position. Then you'll be needing a towel. So yung inibutang ang towel din yung nag-unapit para hintras yung susunod. And then yung buhat ang indication na ni is type ang iyang muscle. Yung buhat is push down kasi yung shoulder or kapila. And then makita niyo if type ang iyang next minor if dili mo touch sa bed ang iyang shoulder. So
weird. I'm not tense. There's still like a lot. 7 pages. I'm gonna use it for the toilet. Oh, I thought you said I was next.
So for the red test, yung button kay one arm can hold anterior subromial, and the other holding the elbow 90 degrees. Then, the PP kay EME is a passively extended shoulder, and then IR and ER internally rotated, internally rotate. Yung palpate ka sa mga tendon sa rotator cuff. Then positive test na ni kay eye depression of more than one finger width. And also if gradient curiosity is bigger outside of the and then indication kay rotator cuff next.
You can just ask
For elbow weakness, okay, you can have your patient prone. So, di ba your rhomboid inserts at the medial border of the scapula. So, in order to palpate the insertion of the rhomboid muscle, okay, imoy siya sa patient naman. Can you please put your hands at your back, like sa back pocket lang na part. So, are that it? So, you're gonna have to palpate the medial border of the scapula. Okay. So, ang mga na ng patient na ni guys, kay ego rin niya i-lift up. Like, you don't have to apply resistance. You don't have to resist sa motion sa patient. So, ma'am, can you please lift your hands up to the ceiling? Sige. Balik-balik. 1, 2. So, if lift up galing niya sa yung kanang hands, guys, then i-feel ninyo ang inyong fingers kay mo, ano siya kung ana. If that's a normal sign, but if illegally mo lift up in yung fingers, kay that's a positive sign na nasa your rhomboid weakness. So, balik lang ha. Okay. Kanang, if makita ninyo, if mo doon mo din yung mo, ana, gamay mo akong fingers. Then, Marshall will lift. So this is basic one.
Maybe against resistance.
So that's a normal round. We'll show you what it is.
Like, is it? It's weaker. This one is stronger.
Okay, so let's say for example nag-winging ang scapula sa inyong pasyente. So you know naman ang winging gawas din yung scapula here. So what you're going to do is automatic. You're going to try to test for the serratus anterior, right? Because okay na ang try. It's a muscle that's making your scapula protract. So what you're going to do is that you want your patient to forward flex, no? And then really flex on yung nalunod para maka-lunge, para maka-upward. This is a scam. So you're going to say, ma'am, I'm going to try to push your elbow backwards. And then I want you to resist that force. So we have a start to look out. While we're doing this, you can try to palpate it and I'm hearing contract in the hair. So 1, 2, there you go. If you're not going to contract here, same as hindi na relax. On niya, making ko sure here sa first part. But basically, naman ay gibutan mo to different shape along thoracic, vertical palsy, whatever. Kaya, paano good if there's a possibility nga nabisod lang o mugang imong serratus anterior because unstable ang imuhang posterior shoulder here. So what you're going to do no, para eliminate yung imo is it really the shoulder or the serratus anterior ang problema? So what you're going to do is for you to identify if it's the shoulder, you want the patient to laterally flex their arm first. One at them. And then you flex their arm forward. And then, if nakabantay mo, if wala na siya ni wing against scapula, pasabot na the possibility nga it really is the shoulder or the IQ. Another way you can do the punch out test is that you want your patient to do a wall na lang push up like this. Yan. Ako naman yung kana, gawas mo nila ang ilahang scapula if there is any. So this is scapula. So now sa first part is it the second thing that you should be doing or the first one?
You have everything na lang.
Serratus anterior weakness, sir. Okay.
So, additional thing, make sure that i-focus sa patient sa lateral kidney, kasi yung mga patient, okay, kasi sa exam or sa lab practice, kasi okay mo lang kay hindi ka iyaw kay ano na related, so sa mga yung drops, so may muscle or
Sir,
make sure na familiar mo na.
What does that mean?
Next guy is speed test. So the patient is barograph. Then after forward flex at the patient 90 degrees. Then after stabilize ang distal humerus, ang forward niya kasi pinag pa. Then sa kang pag-resistance there sa wrist. After
annoyed na yun. Intervertebral sulcus orbis.
Then next kay pronated side. Then ang indication natin kay bicipital tendinosis, ang positive sign natin kay increased tenderness sa bicipital when supinated.
Lang kita dong. Yeah? Yeah.
musculoskeletal, suprascapular.
It's so excited. Let's stand up. No, it's the one
Test
with
na
like...
ako if na siya is to find out if na ay sprain and teres minor muscle. So mura siya MMT kag sa rhomboids. So patient is in prone, yeah, you'll have his arm sa ikot nila ng yani. So you'll have the patient extend and adduct his arm. So sir, pag-ulit ang arm sir, yeah, move it towards me. Yeah, mag-apply na mga stance apply yung finger resistance opposite sa yung igupat ng motion. So now,
No, but this is like much because more
so ang positive sign ani if na ay pain or weakness niya makaya ang resistance or if na ay pain sa kanya nalapitan silang
then you know something.
lawas ng teres minor. Okay, let's see.
Yeah.
So for your cup weakness test, you're gonna have to perform for a test. So first is you check on the heads of the trapezius, then you do upper, middle, and then lower fibers. So to check all of them at once, you have your patient sitting, then you have them put their hand over their head. So you have right? And since the trapezius is a retractor muscle, what you do is you push the arms forward. So you just move here, push it forward and you keep resisting. So, preferably, you just have your shirt on. Pero basta maka-resistance siya, you can deduce na activate na kanan. Then, after that, the next thing you do, we're gonna test your upper trapezius. So, you test these one at a time. So, you have your patient abduct their arm 90 degrees, keep your elbow extended. Then you tell them, okay, sir, so I want you to push your hand down, and put your head to the side, don't let it move. Okay? So, this is for your upper traps. So, you push it, and then 3, 2, 1. Maka-resist or siya for side flexion stronger in traps. Your next two, you'll do it in prone. So it's your middle and your lower trap. So you're taking them prone. And then for your middle traps, because your middle traps are here man, right? So you have your patient have their arm 90 degrees, and then you have them when you rotate this, right? And then you will hold down their elbows. But the resistance is actually here. So you want to push over here on the shoulder. And what you want them to do is you want them to resist it. So causing it to retract. The resistance is allowed, that's for your middle traps. Then for your lower trap, you bring the arm at 120 degrees to the fourth Japan here. The resistance is not on the arm, and the resistance is on the shoulder. So you provide diagonal on the arm, also the shoulder. So please support up and down. And madara niya, that means lower trap versus strong. So if at any point failing the patient, right? So the upper test, the middle is lower, then you can deduce that it's those fibers that are weak.
What fluid? Which remaining? Yeah. Is this
dapat i-adapt siya. Padong na siya sa imong, walay na siya sa imong shoulder.
This is subscapular.
Instruction ra ani
In general?
General rotator cuff.
No, it doesn't say like anterior rotator cuff.
mag-push downward ka, then imong i-match ang kanang imong resistance. So, instruct ka. Then, imong i-instruct ka pag imong patient ka, kasi na siya mong feel di, currently siya mong So, positive sign na is pain in the shoulder, then indication kahit work operator cuff tear or severe relationship.
Last, for the muscle, replacers,
It doesn't specify if the patient should sit or stand, but most of the patients sit down. So what we're going to do is flex the elbow 90 degrees, rotate, and synchronize the thorax. For the PT, what you're going to do is resist the and at the same time you'll go back towards the Okay, I'm going to resist. And immediately we'll feel the tendon in the bicycle.
Stabilizer.
If you can feel the tendon popping out of the bicipital groove, it means the transverse ligament is torn. If you can feel tenderness without sensation,
Nice to know.
paratendinitis or tendinous.
For biceps tendon.
Then the arm is at 45 degrees.
So it's not. So really can just like look for the distal biceps tendon as the proximal.
Arm running niya may mga 45 degree angle. So this is to test how the scapula stabilizes during under dynamic load. So the load may be anteriorly, posteriorly, inferior, and superior, inferior.
I wonder how the
Then
works.
the load can be from 1 kilogram to 3 kilograms, and the scapula should not move more than 1.5 centimeters. Then the base, then we can also test for scapular and humeral stability by performing an eccentric movement at the shoulder by pushing the arm forward.
Are there tests na wala ning gawas sa blood mo right now? For those who are absent. Yeah, but there's like only 60 or something. Yeah, superior. You can play anterior, posterior. This confuses me. Does this need a machine? Can we find
More than 16 kilograms or below. So then, like assuming my patient is more than 68 kilograms, so I'm gonna give them 5 pounds for the say the dumbbells. So what I'm gonna do is the bottom motion is Anika, and in the full scapular duction and full elevation. So basically this one is so
just is this the
our position na is sa likod ng patient. Supposedly open yung scapula ay yung likod para magkaroon ng motion sa scapula. Yan ang button for 3 seconds pa up niya, 3 seconds pa down. So iludod na naman ang scapula. So ang indication namin is sa motion sa scapula sa mga kuan and ay kasi scapular dyskinesia. So may ilan yung positive is ay may ilan yung mga siya wrong kay dili magtuman ang scapula or dili mag-tarong hold ka ng movement.
And we're actually finishing this in under 2 hours. Yeah, it's a lot. I can't think of it too short. The easiest one. There's 70.
Everything that's breathe. fail from holding for less than 50 seconds rather, make ang iyang vocabulary.
Also, obviously, we're going to see weights.
Kaya guys, for Franks, lang kung makarating si Casey operates pero iba wala na akong ang idea ng
Wait, which one, sir?
So, sir?
Which one did it for the crack, sir? Oh, okay. What? CKC, not part of cracks. Yeah, not part of cracks. You wanna do that?
So, ganito guys, position mo imong patient, client, kay usually client ani kay athletes man. So, mo sa give up push-up position. Yeah, 36 inches ang drop there sa tape guys. So, imong instruct the patient, what I want you to do is to lift your one hand, imong duration, other hand, vice versa, as many times as you can for 15 seconds.
Sa lower.
1, 2, 3, go.
Go, Jake.
Pero for women guys, kay Neil, naka-Neil, sa nila, babae kay, actually, hindi nila makaya. 3 times siya.
Sexism.
Average score na kay, kung sa 3 times yung bottom niya, safer siya po ng iyang amount of time.
Okay, so kala na, so pag-promote ba yung patient, make sure lang sa ang form yung patient kay sakto ganyan mo yung weight na above the so kala na make sure lang sa sakto or otherwise
I'm gonna flip my shit if it turns out I have 3.
You can't because I'm the last person. Very well reputation didn't give me
Are you going home for lunch?
Yes. The gap is so absurd. This is at 3. For you guys.
Yeah, just lunch for She already ate. She didn't have breakfast. I need breakfast. What do you want to do?
I woke up at 7.
Yeah, I saw that.
I'm just gonna read self-ethics.
Other than arcade.
You know what I'm gonna do? Mag-download ko Quora.
Doing palpation.
I'm downloading it.
So for this time, okay, we're going to do ULND2, which biases the median, customer continuous, and then the accelerator. So same position on the fine. And then ang difference din niya sa actually pattern, but the difference din from one is that from one any content and function sa
So, ay technique ani nga, important ka ngayon ani is that you end with the elbow movement. So you start with forearm, and then wrist and hand, and then last na ang elbow movement. And then, for this one, okay, ang technique is that it's also important na mag-start mo tanan sa shoulder depression. So the technique for ULND2 is you push the shoulder into depression with your hips. So, anya naman maka-start if naka-depress na ang shoulders. Depress ang shoulder, and then after anak ay you supinate. So, ang mali ang kamot, you supinate the hand, and then if any time maka-feel mo nga may sakit na, you ask the patient na, sir, let me know if wala ka ma-feel na parang na pain, sir. So, supinate, then extend the wrist and the fingers, and then lastly, if kaya na galing patient di hapon kay, you can do elbow extension. If small kaya gapon niya, sir, I want you to bend your head towards your left. So, if nai reoccurrence of any of the symptoms in any of the positions after I will also downward. Then,
Because I didn't take this into account. Ano wait lang idea? It's to part the 70. Yeah, we have like 2 pages. She told me she only had one. She doesn't.
And then following the shoulder, the next position.
She missed
Arms,
She
first one,
had to. She
both
said she
arm
had
hands
to.
maybe.
Maybe
Forearm
just
is
missed
communication. And then the flex would be the wrist. The wrist would be flexed along with the fingers. And the elbow will be extended.
It's the first month. I
And then
want to
for
use
the
for Maya.
nerve being tested,
Okay. I don't know. Let's do it. I don't know.
Type 4, okay. The difference here is that the elbow is flexed compared to the 1, 2, 3. So the shoulder is depression and abduction then 90 degrees at here. So and then for the it's abducted to 90 degrees. The elbow is flexed. And then the forearm is either pronation or supination.
That's for
So that wrist is also extended, and then radial deviation,
like in
and the fingers and thumb is
like
also
from sitting
extended.
a little bit. Yeah, that's how it goes.
So, and then cervical spine should be on side flexion, contralateral side, whereas to enhance affect the and then for the nerve bias for this, it's ulnar nerve
There's actually multiple. There's multiple album stars actually. There's even one for the first. Yeah. No, that was me. No, you had another one. Yeah, like earlier in the beginning.
Oh no, it's okay. I overslept, so like I never listened to it.
What's the reason for turning your with their hands off the fence and then there's stand on another and then naturally rotation of the free to go or free to contain the radial pulse. So when you've already found the
This is the
radial pulse, you have to ask
a second version of facial.
extend your head and rotate sa extend your head and then it's supposed to be no, back at the side. And then we'll have the association to take 10 and then hold it. And then so if like when I add it with the centurion pulse, then positive indication. And if positive indication, disappearance yung pulse, and if recurrent kami yung mga bad symptoms. And then ang indication kay acid allergy.
Fever syndrome, otherwise known as military brace. It's good for patients who complain of symptoms while they're wearing a heavy backpack or they're wearing a heavy coat. So
Wait,
your
same thing
patient is
as what?
sitting down, locate the radial pulse.
Except there's this.
And then you draw the shoulder
Oh, this one's different.
down
This
and then back.
faces.
The positive side of this test would be the absence of a pulse and the reproduction of symptoms.
This reproduction of symptoms. Just
So for the consent maneuver, the patient is sitting and you will have to locate the radial pulse. Then what you will do is you will provide traction of the affected extremity while the patient is hyperextending the neck and contralaterally resting. Then, positive sign niya is replication of the symptoms and the absence or the disappearance of the pulse sa radial artery. Then, indication ani is the thoracic outlet syndrome.
ikaw na busy. Ikaw na. The duality of women. Duality of women. The duality of women. Yeah, and then
So, pagbaton kay gross test. So, ang basic salita ma-overlay yung ipa 1990 ang
yeah, it's Call of
patient.
Duty.
Sa both arms, 90 na 90. Yang bata na sa patient kay for 3 minutes, close open na siya sa kamot. Yang kuan 3 minutes ha. After mga 3 minutes kay maka-feel siya of numbness, kanang heaviness, tingling sa either side. Kung sa side na nahin na siya ma-feel kay mo affected. Or hindi niya makaya 3 minutes, kakad side, magya po na thoracic outlet syndrome.
Excuse me.
So for the right
Bacteriology. What the hell are you doing?
the patient to
I'm just, this is so AFK, right? I love it so much.
So indication of idea is inferior linear stability or laxity. So ang idea dyan niya is magugo dyan ang patient. Can do it sakal ka ang sleep. So ang imuhang contralateral na shoulder is stabilized and then provide contraction sa iyang affected na shoulder. There is a distal na humerus. Yeah. Anak, imong provide traction. So positive siya if na-increase sa iyang swimming process, magulubog or na-sulpos. So ang negative kay assess ra wala kay marang increase sa iyang swimming process. So nani siya grading actually kay pwede pa rin mo ma-measure ang swimming process natin sa katang head sa humerus. So ang grading na niya is 1 plus kay ang distance sa duha kay 1 cm or 1.5 cm and then 2 plus is ang grade 1 is less than 1 cm or less than 1.5 cm. Then grade 2 plus is 2 cm is 1 to 2 cm and then grade 3 is 2 to 2.5 cm. And positive kay na siya inferior glenohumeral joint na laxity.
What's the name of your Yes, I have a shot.
Yeah, there's a big gap.
Positioning mo kay either naka siya sa iyang head part or pwede po ba nasa iyang kilid up. So one hand kay nasa posterior aspect sa shoulder over the humeral head. Tapos ang isa kay nasa humerus ngayon na siya by external ear plate. So naggunit ka lang sa yung humerus or distal humerus. Here po lang direct. So i-push nimo din yung shoulder anteriorly. Push nimo siya anteriorly. Or pwede po ka mag-timog face. Tutanin mo din. I-push nimo. So ang positive sign na if na ay clump or rising na sound. So mo-indicate na siya there sa lab group.
What if I just...
Kailangan kasi post ko na ito.
Yes. Last one.
So for the positive side, patient obesity, the test So for this, base your thumb and they go under the posterior lateral aspect of the AC. So of course, locate the AC first. Apply force going anterior superiorly with your thumb. And then with your index and your long finger, you apply an inferior force on the middle part of the body. Then you press. And the positive side for this would be pain and the AC joints, indicative of lumeo-clavicular joint.
So that's it for the special test. So take note lang guys, so kanita na yung special test na pagkitan mo pero dili sila ang all special test for shoulders. So tagal pagkakili sila bro, dipilihan ang sila mo or magamit yun sa fitness kailangan ba lower sa statistical background or mga
sila. Baka na lang, hindi sila kay mga usually magamit yun sila sa clinic. So, naisa ka special test, wala na lang BI, pero I want to like to take note of it, like acne scratch test, usually for frozen shoulder. So, dinid na siya apil ako sa exam, dinid na apil sa lab racks, baka na lang, take note of one na special test, like acne scratch test. So, again, na siya qualification of patient, and isa sa akin ang gamitin sa rehab since tagan po frozen shoulder. So, tanda lang, so, if you're okay na, so we can go. So, kana, lab sa ni guys, kay, again, giving mga medications, or let's say, mga slap tear, so giving manifestations sa slap tear, then pag-unimaan na, so, let's say, if EOS food, dahil naman ang EOS, diba? So, same naman sa medication ka ng EOS. So, it's really up to you what you're going to use lang. But of course, you should take notes on sa mga other considerations. So, let's say, si patient may dipili ka bago, so gamit ang kalingkod, decision test, yan ang nalang. So, kagad yung possible answer, so you have to choose your best one. So, kanisa, kaya di siya yung very correct answer, yan siya yung best answer lang. Hindi siya yung super correct.
Sir, meaning ang katong mga task nga wala din mo gipang highlight.
Wala. Pero usually sa mga walang time sa highlight pa.
Na kay katong green.
Wala na sila sa discal wala na sila indicate mo high yield ba sila or high support ba sila, low support, low support. Wala na sila indicate. So wala lang sila kung ano highlight.
It wouldn't be paresthesia. Analgesia. What it's for.
Kaya lecture exam is mga situational na usually. So usually
Your cookie's good. Yeah, my cookie. Not mine.
Sir, pwede rin ka mo mga numbers. Mga numbers. Mga degree. Wala ka na. Ayun lang, sir.
Pag more na ka, sir.
If mag-want to, more likely sa if katong mga mga innervation, certain akong mga organic kung sa winging slot, katong gani mga winging, mga insertion, kay katong especially sa slot that part maguna ka na, nabuhat ang exam. Na-print.
Balik.
Isudo lang sa service guys. Mana ni di ba pa first running ko pa day. Pagpundo sa daan sa.
Lang yan to.
Isudo lang. Guys, ali jo gahit lang na topic so sometimes ko.
Lang kayo to sa buang. Sabay. Lang kayo to rin do. Lang kayo to. Mahal lang. Mahal lang.